I will approach the scene. I'll make sure the scene is safe. I'm going to provide privacy for my patient, and then I'll wash my hands for 20 to 30 seconds following the WHO guideline. After washing my hands, I'll approach the patient. Hello, good afternoon. How are you? He says it's fine. All right, that's good. How may I address you, please? John. I'm one of the nurses that will be looking after you today. John, are you able to tell me your full name? And he says his full name is John Okafor. Okay, John Okafor. How about your date of birth? 13 June 1964. Can I confirm that with your wristband? He says yes. Date of birth, John Okafor, 13 June 1964, 13 June 1964. Hospital number 242. Hospital number 242. I have the right patient. So, John, I see you have a red bracelet on. Can you tell me exactly what you're allergic to? Is it latex? Is it food? Is it dust? He says, okay, he's allergic to dust. Oh, and when you come in contact with dust, what do you have? He says he has anaphylaxis. I'm so sorry. I'll try today and we'll try everything within our reach to make sure you don't come in contact with dust. Is that all right? He says yes. Okay, so John, I've come this morning to suction you, maybe really because of your allergy to the dust, you've been having this very bad difficulty breathing and you're unable to clear your secretions in your airway. So I've come to suction you. Do you understand what that is? He says no. Okay, that's all right. I will explain to you. So I'm going to use a tube like this and pass it through your nose, through your throat, and down into your airway to clear the mucus and those the thick secretions that are in your airway that you cannot clear. Do you understand me? He says yes. Are you happy for me to go ahead? He says yes. Okay, I would like you to position properly for me so that I'll prepare my things and come back. Okay, so I'll adjust my patient to a sitting upright position. Just tell me when it's comfortable for you. Okay, that's all right. Since you're not saying anything, this is okay. I'm happy with you like this. So I'll quickly prepare everything I need and come back. I'll leave the patient's bedside. I'll wash my hands for 20 to 30 seconds following the WHO guideline. After washing my hands, I say so I can confirm my trolley is clean and my equipment are all calibrated and ready for use. So to prepare my trolley first, I'm going to bring out my suction machine. My suction machine is calibrated like I mentioned earlier. I'm happy to use it. I'm going to bring out my catheter to connect to the suction machine. It's intact. The packet is not broken. It expires in 2027. I'm happy to use it. I'm going to bring out my nasal catheter. My nasal catheter is intact. It's not broken. The packaging is dry. It's sealed. It expires in 2027. I'm happy to use it. I'm going to also bring out dry gauze to clean my patient's face, just in case the face is soiled. It's intact. It's not open. I'm happy to use it. It expires in 2027. I'll drop my dry gauze. This is my gauze. I have gauze. Hey, come out from there. I'll drop my gauze. And what's the next thing I need? I'm going to get a bowl of sterile water to lubricate the tube before I pass it down my patient. It's right here. And finally, I'm going to bring my Google my face mask. So at this point, I'll take the trolley back to the patient. Hello, John. So I'm back now. I'm just going to quickly don my PPE if that's all right by you. I'll wash my hands for 20 to 30 seconds following the WHO guideline. I'll quickly don my disposable apron. I'm going to then wear my face mask, wear my eye shield, and also wear my gloves. I'll come back to the patient. Hello, how are you? Are you still happy for us to go ahead? He says yes. All right. I'll now pick my catheter. I'll open it in an aseptic manner. Open this nasal catheter in an aseptic non-touch manner. Open my gauze also. Then the first thing I'll do is to connect my catheter to the suction machine. After I've connected it to the suction machine, I'm going to turn on the suction machine at either 100 to 150 millimeters of mercury, or I keep forgetting the kilopascal, or 20 to 60 or 20 to 40 kilopascal. I have to remember that one in case I see kilopascal. Then I'll check with my thumb to make sure the suction is working. Suction is intact. I'm happy to use it. So I'm going to quickly take the nasal catheter and connect to the suction. Hello, John. So I'm about to start now, okay? But before I start, I would like us to establish a signage. Raise your hand if you feel uncomfortable. If you feel like you're out of breath, please raise your hand and I'll stop. Is that all right? Okay. And also, sniff through your right nose while closing your left for me. Sniff through the left while closing the right for me. Which one do you think is more patent? The right one. So I'll be using the right one. I'll quickly take my nasal catheter. I'm going to lubricate it in the sterile water and then insert it into the patient's nostril. While doing this, I'll be observing the patient's vital signs, the patient's look, the patient's color, to know if the patient is in distress. Prior to this time, I've made sure my oxygen is connected just in case my patient goes into distress. I will advance the tube, and immediately my patient starts coughing uncontrollably or I feel a resistance, I'll pull out the tube for 1 centimeter, and then with my other thumb, I begin to apply suction intermittently while rotating the nasal catheter and bringing it out of the nostril. John, are you okay? Don't forget, if you're not okay, please tell me. Is that all right? I will do it like that, applying the suction intermittently in a rotating manner or rotational manner, bringing it out of the nostril. And when I'm done, I'm going to observe my patient again. John, how are you feeling now? Do you feel better? He says yes. Okay. If he was not feeling better, I would repeat this procedure or this process for 2 more times. While before doing it, I will change the nasal catheter, lubricate, flush the nasal catheter and the catheter connected to the suction, and then change this one that goes into the patient. But since he's okay, I'm happy to discard everything I've used. So John, I'm going to leave you now. Your face is not sore, so I will not be cleaning your face. Are you comfortable? Are you okay? That's all right. I'm going to quickly leave the patient's bedside, discard everything I've used, remove my gloves, remove my apron, remove my face shield, wash my hands for 20 to 30 seconds, then I finally remove my mask and discard. After discarding my mask, I'll come back to reassure my patient. Hello, John. I'm done with you. Are you comfortable? He says yes. How do you feel? Do you feel better? Do you feel like your airway is clear now? He says yes. Okay, that's all right. That's so beautiful. I'm happy to hear that. We'll be around. The call bell is very close to you. If you have any concerns, if you have any worries, any difficulty breathing, please press the call bell. I will be right here to attend to you. Is that all right? He says yes. So at this point, I'm going to leave the patient, document that I've suctioned the patient, and I had just one go at it. The patient's vitals before and during and after the procedure were all normal, and even after the procedure, I was happy with his condition as compared with the baseline I had before I started. So I'm going to keep the whole place neat and tidy for the next nurse. Wash my hands for 20 to 30 seconds following the WHO guideline, and then leave the patient's bedside. If I forget